Well, so the risk to Florida remains low. Um, and I think that's really the risk to the country as a whole still remains low. And I think people should just take, just proper precautions. If you're somebody that has a real serious condition already, you should view it differently than if you're 25 years old and don't have any problems. But there's low risk right now, and we want to obviously do what we can to contain the limited number of cases that we can have. So you had the travelers from Italy. They've been been in isolation. We anticipate. I announced that there was a presumptive positive with the traveling companion for the woman in Hillsborough. That still hasn't been confirmed by the CDC, but we're under the assumption that that is a positive, and so they will be. And then there's investigations going on about all the contacts that people have had. And if you've had contact with somebody who was in Milan recently or in China, then we're recommending the self-isolation at that time. So that's the playbook, public health playbook that has proven to be effective. We're doing that. I think the state, between state and county, they've done over almost 1,000 monitored over about 1,000 people thus far throughout the state. So these are people that may have been in some other part of China, but they come 14 days, temperature check, seeing if you develop symptoms. Then obviously if you develop symptoms, then that you would end up being tested as a result of that. And so we have not seen widespread outbreak here or in many parts of the country. And, we're working hard to do it. But at the same time, we have 125 million visitors a year in the state of Florida. The girl that came from, or the young woman who came from Milan, she didn't fly from Milan to Florida. She went to New York City, and so she just came on a flight from New York to Tampa. And so you're going to have people. I was just in Orlando with the folks there. Just think of how many people go into Orlando from a variety of different countries. And that's just going to be a reality. They're attuned to if foreign nationals develop symptoms, how to respond to that, and I think that's obviously important. But then I've also stressed to the Vice President, I think those China travel restrictions worked. I think that's a big reason why we don't have wider spread in the United States now. I know they're doing significant monitoring both pre-flight and post-flight from Italy.